Well, welcome to another episode of the Public Health Entrepreneurs Podcast. I'm your host, Dr. Huntley, and I am joined with a very special guest today. So I'll let her introduce herself in just a moment. Just in case you are tuning in for the very first time, on this podcast, we cover topics of interest at this intersection of public health and entrepreneurship. So today's episode, I've invited a guest to kind of share her journey and her story and talk about what she does to give you an example of what's possible. So our guests are not meant to give us like an all-inclusive list of the possibilities, but just to give you a chance to hear from an entrepreneur and learn about their journey for inspiration. So my guest today is Lashonda Richardson. Hi, Lashonda. How are you?
Hi, Dr. Huntley. I am good. I'm glad to be here.
Well, I'm glad to have you here too. We've worked together for a while, and I've really gotten to know you well. And one of the things, little fun facts for me, is the fact that I'm in South Carolina, you are in North Carolina, so I say you're my neighbor.
Yeah.
Why don't you tell everyone a little bit about yourself in your business and what you do?
Sure. So, my name is Lashonda Richardson. I am the founder and CEO of Emerge Public Health and Community Development. The mission of Emerge is to educate, motivate, empower, grow, and evolve. And the purpose is to make sure or to ensure that individuals have the resources that they need, that they are educated on public health and issues, and to eliminate health disparities in our communities, in our businesses, where we work, in our families. And that is mainly what I do. I am a public health educator. I also consult with businesses and organizations to do resource evaluations on how their resources are working for the people that they are serving in their organizations or their businesses. I also plan, host, and facilitate community events around public health issues. So, to make sure that we are educated and we have the opportunity to make healthy decisions about our health.
Nice. Yes, we're going to dive into that a little bit because I want to know more about your business and explore a little bit more about where you are now. But for a moment, let's step back a little bit because I think it's nice to give a little bit of a retrospective view of the journey, you know.
Mhm.
So one of my favorite questions is to kind of learn about when you first discovered. So like when did you first become interested in public health or discover public health as a career option?
Yeah, so I always knew I wanted to be something in the health related field. And of course, growing up, it always changes and things. So I started off working in a pharmacy, and I really loved pharmacy. And I was going to be a pharmacist. I was planning to go to pharmacy school. And once I started working in the pharmacy, I developed a passion to see if I could help people before they got to the place where they needed the medicine. So before they got to the place where they were sick. And also, like in my family, just having people that dealt with illnesses and disorders, and they didn't have the information that they need, or they didn't understand it. They knew to take medicine, but they didn't know how or why or where it came from, or the questions to ask to doctors and things of that nature. So that's how I began to develop a passion for more of the public health and more of the education and more of the preventative part of health and education. Of part of health education. So that's kind of where it started for me. And so when I started seeing where I could help and I could educate and I could help to eliminate these health disparities and give information on how to prevent some of these diseases and disorders from even happening in the first place, it became what I knew I wanted to do.
I That resonates with me so much, and I know you've told me this before, but it's like I'm hearing it for the first time. That is a lot of my passion, for seeing what's happened in my family and like,
Mhm.
we could have prevented this. Like, why did Big Mama have to, you know, have these complications from diabetes at such an early age? She's in her early 60s. I'm like, what, I didn't have the words for it back then, but I knew I was like, something's not right. I know that also there's this, I'm personally on this journey with, I've been fighting type 2 diabetes. I was diagnosed when I was pregnant with my daughter, and then she was born, and now she's an adult. So I've had it. It never went away. So it wasn't just gestational diabetes. It never went away.
Hmm.
And so I've always been very much motivated about, by exercise and nutrition and all those lifestyle behaviors and patterns and things you can do. And also realizing that you can do all of those things and it still can kind of, you can fight with it, right? So I'm not anti-medicine or anything like that. I think the way that I've approached it is because I do all the things that I can do. If I'm adding on medication, then I feel a sense of peace that, okay, well, I'm doing all I can do. And then I'm
Right.
taking like the minimum amount that's needed to help me to maintain and manage. But I'm such a big advocate of those adjusting those lifestyle changes. And I'm here to say, just because the obvious, if you're watching the video, you see I'm letting all the grays show, so it's like represents my stage of life. But to say that your needs and what you do to as far as activity and nutrition and what works in your 20s may have to be adjusted in your 30s. It may have to be adjusted in your 40s and so on. So it's like it really and truly is an ongoing thing. And I think that what you're doing and how you're focusing on the community is important for all of those reasons. You don't just hear it one time and, oh, you're good and you've got it. It's something that we need to revisit often, right?
Absolutely.
Yeah. Tell us, let's talk a little bit more about what you do, because I'm familiar with these health fairs. I know we talked about that and getting started, but tell us a little bit more how you started. Like, what were your first steps, and how did you move into all the offerings that you're having now, that you have now?
Yes, so I started mainly with the events. So there are so many health disparities that we have, but there are calendars that some of our health and organizations have developed that break them down into months or days and things of that nature. So using that as a resource to say November is National Diabetes Month, or October is Breast Cancer Awareness Month. So taking those times where there are observances for those days and developing them into educational and awareness events where it gives people the opportunity to learn more and to just bring awareness and to make those lifestyle changes and see about family history and all of that stuff. So educating on that to make sure that those observances are even more, like, they're even more made more aware of even during those times, and working with businesses and organizations about their resources. Just understanding that even in working in corporate America, working with my coworkers, that I see people that have these resources, but they don't know how to use them. They don't know how they work. So they aren't really being to them, even though the company offers them. So having the opportunity to come in and say, okay, let's see, if you're having five people or 500 people, say that may be a little bit, but out of work, like, at this minute, like, what is going on, like, what is happening, if you have these resources in place to assist them, what is going on that they aren't being used, or what is going on that they aren't working. So helping them to evaluate, if you have something in place, how are you ensuring that this is working for the people that you are offering it to? And if you don't have it in place, talking with the employees and the community to see where the gaps are, to what is needed, what can they do to help you to be a better employee or to live better in your community and operate better in your community. So those are the resources, and those, like, that's just kind of how that all works and what I offer.
Yeah. What kind of companies or organizations would be kind of like an ideal client for you to go in? Would you say like a smaller or larger, or is there a certain type? How would you describe it? You may not have it perfectly niche. It's not a trick question, but
Mhm.
just in case someone is, wanting to refer you to an organization, is there a certain type of niche that you look for or type of client that you look for?
Yeah, so I've worked with pharmaceutical organizations that have been bigger. Like a lot of them are larger, big corporations, and I've also had the opportunity to work with some nonprofits, even from developing courses or some type of coursework or some type of activity for children in mental health and things of that. So I've worked with larger corporations, and I've also worked with smaller nonprofits. So I have a kind of a wide range of organizations and and businesses that I've worked with.
Okay. So here's, I'll put my coaching hat for 2 seconds. Put my coaching hat on just for 2 seconds. I am thinking that about my own background in pharmaceutical industry, and I was thinking, just from that perspective of really seeing where your services could be needed and could be utilized, because there, I just remember there were been, and I worked remotely way before it was cool and everybody was doing it.
Mm-hmm.
So there was a challenge to, like, there was this one part of me, I knew my basic insurance and like those benefits, but there was like a whole portal of other things that the company provided that I literally would stumble upon at times. Like, oh my gosh, I didn't know I could get this for, the company's providing this as a free benefit. And then some of the things, there was one benefit that I didn't understand until I was in there for 3 years. Like, I didn't even understand, like, oh, that's something I could take advantage of. So I definitely could see how, doing that, how that could be very helpful. So that, do you go through, would you go in, or connection point be like the benefits coordinator or benefits person at an organization, like connecting
Usually,
them?
yes. Usually, it's either the benefits coordinator or the HR, going
Okay.
through HR, and because of all of the rules and things of confidentiality when you're doing surveys or having to talk with the
Hmm.
employees, but usually working with benefits coordinators with the HR representative as a team and coming together to see how it's best to organize and to plan the assessments that would be needed for working with
Yeah.
the employees. That on the business standpoint, yes.
Okay. So I'm just gonna, leave that right there, because I think that's a great way, because you already have a connection to the pharmaceutical industry, multiple, like you told us in your early journey of, when you first really discovered public health, you were working in that, going in that direction, and then your
Mhm.
corporate connections, since you've been working, and I think that that's a great way. Now you've got me thinking. I'm a natural connector anyway, so I'm thinking about people. So that's going to be top of mind for me when I hear somebody say that, or when I connect or reconnect with some of my older colleagues and that are still in pharma. I have a way of bringing that up, and I'll remember you. So that's just a little, how we do. We do a
Yes,
lot, and you're in our mastermind program, so you know how I am about connections, and
yes,
and that's why I said let me put my coaching hat on for a couple of seconds. But yeah, that's such a great resource. Also, I mean, even within on the community level with nonprofits, I do work with a lot of nonprofit organizations, and I can also see where that could be, the services that you're providing could be very beneficial. So at this stage, it's very common to be, you can offer a few different things because you're trying to see where, where you're going to get the most leverage and traction. And those health fairs are just like, they're not going anywhere.
yes. Yeah.
Like, they're so necessary, and you're able to pull partners together, and you do really a great job with those. Um, okay. Thank you for entertaining me for that little journey, little sidebar journey there for a little bit. But I'm a fan of what you do, and I know that you're serving community, that and your mission, everything is so near and dear to my heart, that I think that anyone who's listening, that if any part of what she's mentioning is something that you think is, you could be used in your community, or maybe it's like when we think about nonprofits, it could be a hospital. Hospitals are nonprofit organizations. Maybe they have, maybe you work there, and there's a community engagement piece that the hospital would like to facilitate or coordinate. Or we think about churches, especially larger churches that have these women's groups, and they're always looking for someone to come in, and they're very health focused. I mean, faith-based faith-based partnerships are wonderful with public health. We've heard that for years. So, Lashonda's a great resource for coming in for, and doing and facilitating in those kind of partners and creating those events. And then of course commercial industry, like we're saying, if you're thinking about, even if the I would think even if the corporation wanted to put together a health fair. I know that I have a colleague who is in a non-health industry, a field. She leads a company. Her clients are like these cities in a certain region, right? City municipalities, and mayors are her, connectors. So she wanted to do a health fair, and she told me about it after the fact. Otherwise, I would have reached out to you because she's not that far away from us. But she wanted to do a health fair, and she just like wanted to do it on Men's Health. So that was what, June, right? Men's Health
Mm-hmm.
Month. Um,
Yeah.
and she coordinated that with the cities that she served and pulled partners together and that thing. So you may know, like as you're listening to us, there may be people that aren't health, like running a health centered business, but are very health focused and are driven and motivated to put something like this together. And Lashonda is a great person to have at the table leading these type of discussions and projects. So I'm encouraging all of you listening to be thinking about ways to connect with her or refer her business, and support her as well. So we'll have all that in the description where you can connect with her. Um, Lashonda, I'm going to ask you a couple more questions. I really am enjoying that conversation.
Okay.
Um, so thinking about, we're going to share transparently, and I think the whole purpose of having, you as a guest here, is this real example here. But let's talk about the good and the bad. So first, I'm going to ask you to share what you like most about, consulting and entrepreneurship, and then you can then share what you like least about. But we'll start with what you like most first.
I love helping people. I love the result of individuals getting the opportunity to learn, because a lot of people want to learn. They want to know, and sometimes people don't do because they don't know. So educating people and ensuring that they have the resources that they need, and then seeing them use them and seeing the fruit of them in wanting to learn and wanting to know and wanting to do, the result is always so rewarding. In doing that, the events, they're fun. The planning may not always, be fun because it's a lot of work, but they're fun. And to see people, I'm also a certified community health worker. So in people that I've worked with or have had the opportunity to connect with on a family level, to see them be able to bring their families out, and while they're enjoying the event, they're also learning, even from the children to, so just the connection, the opportunity, and the result is definitely the reward. So that is one of the best things for me, to see the results, to see the positive result and people
Yeah.
getting what they need.
So you just slipped in there something that I didn't know. A certified community health worker. Are you kidding me? I was literally trying to find someone for a project that I have going on. I'm like, and you're right under my nose, and I didn't even know that. That's
I
information I need
just
to know.
Yeah, I just finished. So I the certification for that. So that was something else I felt that would be very beneficial, especially in the community standpoint. And I learned so much in
Yes.
that, even though I've worked with the community before, but just even in how to talk to people from every level and to work with
Mhm.
them. It was an eye opener. So I was glad that I was able to gain that certification.
Oh, well, congratulations. I absolutely love that as an addition for you. I think it does go really well with what you're offering too. And you're like I said, you're in our mastermind group. So when you get back in the community, make sure that you post that because we have another person in who that's their focus too.
Yeah.
She's a so we'll have to really work on that angle in our community. But I think I'm very excited about that addition and how that's going to just, add to what you're already providing. And it so aligns with, what you're passionate about.
Mhm.
In the community aspect, and like you said earlier, helping people before they get to the point of needing the medication and so forth. Being able to, that prevention, that's what we are in public health, right? We're prevention focused.
Absolutely.
Okay, so what about the other side of that? What do you like least about consulting and entrepreneurship?
That you can't save everybody. Because you want to, and because you want to see the result, and you want to, sometimes it doesn't work that way, and you try to save the world because that's what you're passionate about and that's what you want to do, and everything doesn't always work out the way you want to. Sometimes when working with people, they aren't ready for what you're trying to give them or what you're trying to offer, or we know that there are certain stigmas and that there are certain traditions and things of that nature. So sometimes when you're trying to share information and when you're trying to educate, that tradition or that stigma steps in, because they aren't quite ready. And I know we've talked about before, like planting seeds, though. So
Yeah.
you plant the seed, and you hope that at some point, what you're offering or what you've taught or kind of grows or kind of connects with them with in some type of way. So I think that's the part of it. And like I said, with the events, like sometimes it doesn't, things don't go as you plan all the
Hmm.
time. Like it's a lot of work on the outside. So, you wear so many hats. But what I've learned from you for a lot of it is that learning how to delegate and making sure that I'm not overwhelming myself and having a team and things of that nature. But those are some of the harder things that you don't know. But as I've worked and as I've organized things and as I've been able to work with clients, I've learned how to make sure that I am taking the time to not overwhelm myself and having a team. Like if I need to delegate something, then I do that. And just understanding that everyone may not at the time that you're giving the information receive it, and that's okay. But you don't stop, you continue to go, you continue to grow, and you continue to build because people are listening. So
Yeah.
mhm.
Thank you. That's a very real sort of challenge, like you can't save everybody, that realization. I think that also helps us, you hear me all the time. Let's niche down a little bit further,
Mhm.
because there's this want to, you have this desire, well, I want to help everybody. And it's hard
Mhm.
to kind of work against that and kind of, niche it down. I also really like how I'm hearing you prioritize boundaries for yourself, protecting yourself, from burning out. Because especially with someone with a heart like yours, you want to help everybody, you want to do all these things, and you do these projects that are very involved, multiple things, and a lot of it, like us, like you said, taking it on yourself. So just your awareness that, like I'm trying to help everybody else, but I also got to look out for myself. That's huge. I'm really happy to hear that too. So thank you for sharing all that. I have enjoyed our conversation, and I'm going to kind of wrap up and give you back some extra time in your day. You've been so generous in sharing, but I think that people that are listening, I'm hoping that it has been, inspiring to hear kind of some of your journey, maybe a part to that resonate with them. I encourage all of you listening to connect with Lashonda and remember some of the ways that you could refer business to her. Maybe you can just follow her on LinkedIn and read her posts and learn more about what she's doing. I don't encourage people to reach out to a guest and say, how do you help me? Can you help me start my business? That kind of thing, because that's not what they're offering. But these episodes are meant to be inspiring. But do reach out and let them know what resonated with you and what you liked about the conversation, and get to know them better in that aspect. So I'll have all the links in the comments and the description and the show notes as well. So Thank you, Lashonda. This has been fantastic. I really appreciate you being here.
It has. It's always a pleasure to speak with you. So thank you for having me as a
So, well, everyone, thank you for tuning in. And until next time, have a fantastic rest of your day.